madam. How are you down in UK? I hope you are doing very well now. It is my pleasure to welcome to my studio here at the Kidodi podcast. And today we are going to discuss a number of issues, including yourself as Aline Minja, um, uh, born in Sweden and currently living in UK. First of all, I would like to take this opportunity to welcome to my studio at Kidodi Podcast.
Thank you.
If I look your background here, basically, you born in Sweden, correct? You born in Sweden with a Swedish mother and Tanzanian father, rooted in Tanzania, correct?
Yes, that's correct.
Yes. How do you feel yourself as a someone, Aline Minja, that has different rooted with a Swedish mother and a Tanzanian father? How do you feel yourself as a child that with these two different cultural background?
Well, I think, it's a blessing to have a Scandinavian heritage and an East African heritage. Like you said, I'm born and raised in Stockholm, but my father always made sure that he took myself and my siblings back to Tanzania frequently, in order for us to be aware of our roots, our family, our surname, our heritage. So I was very sort of lucky to have the opportunity as a child, as a teenager, and as a young adult to travel to Tanzania a lot to get to know my roots and my family. So I've learned the good things from the both sides, and I'm very proud to be Swedish Tanzanian.
Oh,
And yeah, it's a mixture of both. It's a mixture of two good worlds. It's very different, of course. That's why it's important that I came to Tanzania as a young child so often in order for me to know who I am and where my roots are from.
yeah, there's a curiosity question here. Basically, as you said, it's very good things to be in a different cultural background with Tanzanian father, as well as Swedish mother. Tell me a little bit about the first time you arrive in Tanzania. As your father take you there to visit as the first time, how do you feel about arriving in Tanzania and how the father side siblings and relative welcome you down there? Can you tell me a little bit?
Yeah. So, I mean, the first time I was only around 2 years old, so I don't remember that part. But when I went, when I was around 12 and 13, I was very sort of skeptical, asking my father many questions before we were traveling, where we're staying and what we're doing, because I wasn't really sure what to expect. And I think that's because of the stereotyping, how we see Africa normally. We eat with our hands, we sit on the floor. So I had that sort of stereotype mindset, asking my father, what are we doing? And he said, we're staying for 2 months. I was excited, but also very skeptical. But when I went there, obviously, it was a completely different picture from what I had in my mindset. It was just absolutely amazing. All my family members were there, even my cousins, younger cousins. They greeted us very well and they looked after us very well. And I sort of integrated in terms of I took part of the culture where I was spending a lot of time with my auntie looking after my younger cousins, was supporting with this sort of like changing the nappies and cleaning and supporting them in the household, because I was so intrigued of how they did things differently from how we do it in the Western world. So I was carrying my cousins on my back. There's no pushchairs, but I used to carry them on my back. So it was sort of like I really took part of the culture a lot. And it's a different freedom for children in Tanzania or in Africa in general. In the Western world, you're quite isolated. You can only go certain places at a certain time. But I felt Tanzania was like an open space for me and my siblings to really sort of grow and get to know the environment. But my family are amazing. You know, we still have very good contact. We speak nearly every single day, and I always go see them. So yeah, it's a very good foundation. I loved it.
Yeah. Well, that's very, very interesting historical visit to Tanzania for the first time. And tell me, what age do you arrive in Tanzania at that time? With you along, is that along with your mother and your father that time and all your siblings, or is only you?
It was no, it was me, my two brothers. So I have a twin brother and then a younger brother who's 2 years younger than us. So it was me and my two brothers and my father. My mother, my Swedish mother, she joined few weeks after, but she also came to stay with us. But we came as my brothers and my father.
Okay, good, good. I hope you had a very lovely time during the first visit in Tanzania. You see all the sibling and cousin. Did you see your grandmother as well that time for your father's
Yeah,
side?
absolutely.
How the
Yeah,
grandfather
my
was at that time? How he feel of seeing you as a granddaughter of father of how does your grandmother feel about it? Because in African
very, very
traditional,
happy.
the grandmother always loved to see the grandchildren.
Hmm. Very true. I mean, she's seen me before as a young child, but I think when I was 12, 13 years old, it was a bit different. But of course, she was very, very happy. You know, BB to us is, you know, the queen of the family, the foundation of the family. You know, she's always make sure that we unite as a family in Sanawari specifically. She's a very well-known, you know, traditional religious woman who always support the community. So she never spoke English, so we didn't communicate as much, but we had a very strong bond anyway. It was mainly, hi, how are you? Make sure you eat, go to sleep, and you know, the basics. But we have a very strong bond. And Bibi to me is, of course, a huge sort of part of my life, getting to know Tanzania and my roots, of course, my grandmother. But
Abs-
yeah,
ab-
very happy to see us.
Absolutely, absolutely. I know the route came from Sweden to Tanzania, always as your history. Let me move on a little bit to you. After you studied a little bit in Sweden, you decided to relocate in United Kingdom. Correct. That's where you
Yes.
are right now. Tell me a little bit
Yes.
about moving from Sweden to United Kingdom in terms of your life.
So I was very sort of like eager to move, I would say, because Stockholm and Sweden is a very small country. I felt that I couldn't grow as much. I've gone to school there. I've done my sort of work experience. I felt like what else is out there for me? I moved to a different city in Sweden, Gothenburg. I spent a year or so over there. I did study. I did work. So I tried to expand also within the Swedish region, but I still felt like I can't really grow here. I know there's more for me out there. So I packed my bags. I moved to London, but before I came to London, I did work experience based on my qualification in Sweden. So with that, I did say I want to come back to London. Is it possible for me to have a job here? You know, they said of course. So just moved to London. It's been 15 years now, and yeah, it's great.
Is there any reason why you decided London than other European capitals? Because there are so many European capitals. Sweden is a very nice country as well, as far as I know, but I hope it's a UK because it's one of the global power, that correct, and has a lot of ethnic background in UK rather than Sweden, correct? That's
Exactly. I mean, my goal and my dream was actually go to Tanzania. I wanted to go to Tanzania and work for my uncle at his Airbnb to learn Swahili. So that was like one of my goals. But then when I came to London, I thought, okay, actually, this is also a good place. Like you said, it's very ethical. You know, the culture and the background around here is obviously way much bigger than Stockholm. It's also only 2 hours away from Sweden, so I'm not far away from my family, and the opportunities here are great, I would say.
Oh, okay. That's the main reason why the more opportunity great rather than Sweden, because I know Stockholm, Malmo, they are big city in Sweden. Yeah. Okay, let me move on, madam. I understand that you living in United Kingdom for a while, and then tell me a little bit about your education background. If I look a little bit here, see that you are on the medical field as anesthetic pediatric medical field. Is that correct?
So I work in anesthetic pre-assessment as a senior healthcare assistant in pediatrics. So yeah,
Okay. And how long you've been doing this in United Kingdom? How long? And
I've been part of the NHS for 10 years, so it's a long time. So when I first came to the UK, I had my Swedish qualifications, but I had to redo quite a few here in London to make sure they become more recognized. Sort of my English and my sort of certain level two, so level threes in a healthcare setting. So I had to sort of redo quite a few of my qualifications before I joined the NHS. But I've been with them for 10 years, and I'm still with them. I'm enjoying what I'm doing, of course. And the good thing is the hospital I'm working in, it has a very good sort of like academic opportunities. So I managed to become a senior in my role throughout my career within the same organization. So I've done quite a few qualifications in sort of like team leading, management, or pediatric healthcare in general. So it's giving me the opportunity to grow within the same organization, which is great.
I understand that England is not the same like Sweden, and then basically England has a lot of opportunity, and for you, that's the reason why you relocated in England. To come with other questions, to this is additional question, maybe if you can answer to me, how you feel about when you arrive in the United Kingdom at the beginning of your life, because it's a different culture, it's different people, different food and way of living. How do you integrate it with the British culture comparable to Swedish culture? And then also you see as a daughter of the Tanzanian father, how you feel about England when you integrated with the society?
That's a very good question, actually. It is very, very different from the Scandinavian culture to the British one. I'm still sort of like, after all these years, I'm still learning, getting to know certain things. I'm being very truthful to myself in a way. I don't want to change based on the society I'm living in. I'm still very Swedish and Tanzanian in the UK. But I think when I just came, my English wasn't as good as now to start with, and also the British English is very different from how what they teach you at school. In Sweden, it's very American English at school, but UK English is completely different accent. So I did struggle in the beginning to actually understand what they were saying because of their accents, but I'm getting there. But yeah, it's a culture shock, of course. It's very different, the food, I mean, everything. But regardless of that, I'm still sort of sticking to my roots. Even if I'm in Britain, I might not eat British food. I like fish and chips, but nothing that I will eat. Um, but I appreciate it, and it's different. It's very different from where I'm from. When I came here, I thought, the African community might have a different connection to their roots, but I can also see how the African community has very blended into the British culture, which I haven't in the same way because I was introduced to Tanzania at such an early age, whereas others here, they might have not integrated as much going to Africa. So they're also still very sort of African, but also very British, which is very different from me. But I'm learning from it, and I think it's amazing how different people live their ways based on where you're from. So,
Okay.
but yeah, definitely a culture shock for sure.
It is a culture shock. It is always. Even me, when I come to United States, it was a cultural shock. Basically, it's always a cultural shock. But how you can integrate it with the cultural shock, that is the main point of. That's what I ask you. How you feel about United Kingdom, particularly in London. Let me move on to very interesting question here. As also you are connected to your fatherland in Tanzania, you, you become frequently visiting there. What experience life you have seen? And then also in the health sector, because you are senior health assistants, and how you feel about life in Tanzania, and particular also in health sector. since you've been there frequently many times?
So I haven't spent much time in hospitals and clinics. Luckily, that's a good thing. I would say I've been staying healthy, but also I haven't sort of visited any hospitals since I've joined the organization that we're going to talk about later. But the experience coming to Tanzania is obviously incredible. That's a place where I want to establish. That's a place I want to eventually spend more time as I'm getting older and as my children getting older as well. But you know, Tanzania and its culture and its mindsets is just incredible. I feel like when I'm in Tanzania, I can really, really rest. You know, even if I'm busy, but I'm also very resting because of the culture, because of being around my family and the food and the weather. It's a very, very nice place to be,
Have
for
you
sure.
have you taken your children to Tanzania since you've been there? I know you have two children. I didn't ask you this earlier, the status of your life in terms of marriage, but I believe you have two children, don't you?
Yes, correct.
And then did you tell them a little bit about Tanzania? You say grandfather is born in Tanzania and how they feel about it.
They are fully aware. They've been there numerous times since young and teenagers. So they've been to Tanzania. They obviously met my father many, many, many times. They're very well aware of their Tanzanian heritage and of course from their father's background, their Gambian heritage. They spend every year in Sweden during summertime. So we made sure that they're also very rooted in their heritage. So both my children are very sort of well aware of their Tanzanian culture and spend time with my cousins and my family, of course. So yeah.
Okay, that's fine. That's fine, madam. Well, additional question to you, if you're really happy to answer. Do you teach your children a little bit understanding that the father roots in Tanzania is Swahili? Swahili is one of the most important language now across in Africa. How do you feel about roots? Your root of your father also speaks Chaga. I think so. Is that right? Chaga region in
Yeah.
Tanzania. But also in Tanzania, we have a national language, Swahili. Do you feel proud one day that you can speak Swahili as a fluently to yourself?
I mean, I wish. You know, my mother tongue is Swedish. Swahili, I know very little, understand more, but I will sort of, my children knows about Swahili. They know that Swahili is the biggest language in Africa. They are fully aware of that. I mean, I'll say certain words. They know how to greet, you know, come here, sit down, be quiet, you know, like the basics of Swahili. But you know, I have to speak it, I guess, in order for me to teach them. But of course, they know the Swahili language, absolutely.
Okay, thank you very much. I hope one day you'll be able to be fluently because I know you are planning in the elderly time to move to Tanzania. Swahili will be their main language to speak around Swedish and English and maybe in Chaga. That's your main one in the tradition of your father. All right, let me move to very other subject here in terms of our discussion today. I understood you are serving. You are serving as a volunteer role in your life. You've been to Tanzania and you are director of the program of the social enterprise. It's called Tiba Salama. Tiba Salama. How you been connected to Tiba Salama Health Digital in Tanzania? Can you give me a little bit of background and history associated with the Tiba Salama as Aline Minja while you are in Tanzania?
So that's a very good question. So I was sort of researching around to see for like jobs or any sort of interactions I can do, like a global health. You know, I worked for NHS for so long, which is like the sort of health sector when it comes to the UK. But I'm very interested in to also see about global health and public health. So I saw something online about Tiba Salama, and I emailed the CEO, which is Simon,
Yes.
my very, very good partner, my colleague who runs Tiba Salama. So
Yep.
I emailed him and just like, hi, I'm very interested. You know, I don't mind reaching out to people. I find opportunities will come your way, but you have to get opportunities. I'm not expecting it to come to me. So I like to reach out to, test the waters. What can we do here? You are in Tanzania, I'm in London, I'm clinician. What can I do to sort of serve or help? Um, so we had lots of conversation back and forwards. And then eventually he advertised that Tiba Salama are looking for a program director. So I applied for it. I've sent him application, and then he emailed to say that I was successful for the role. So that's how I sort of got to know Simon and Tiba Salama, and that's how I got the role as a program director.
Okay, that's fantastic. Wonderful, wonderful, madam. Beginning of your relationship with the Tiba Salama in Tanzania, after you find out ways how you can do voluntary work in Tanzania, you end up to Tiba Salama. Tell me about the role you have taken to make a Tiba Salama as a part of your priority to helping underserved community in Tanzania.
Yeah. So, like I mentioned, my role is a program director. So everything is virtually, which means I'm working from the UK, even though Tiba Salama is based in Tanzania, Dar es Salaam. So Tiba Salama, like I said, is a social enterprise company, but we also specialize in digital health. So we built a platform where our workers can sort of look after the mothers digitally. So nothing will be on paper. So that's the sort of the main sort of backbone of Tiba Salama, that we're using an app called eHealth Mum. We haven't launched it yet, so it's a startup. So we're working a lot behind the scene with different sort of stakeholders and partners to join us on this mission, including Ministry of Health and the local government. So my role is to oversee all the programs and all the projects that we are doing. So mental health, nutrition, breastfeeding, malaria, vaccination. So I'm making sure that we sort of gather a team of people to be able to accomplish these programs in the communities.
Okay, let me ask you this one particularly. I hope you can answer me very well. I understand you have a lot of background in terms of the area of the health issues. As volunteer director of the Tiba Salama, how you can associate yourself with currently positions you have in UK, and how you can do more to support, particularly in rural areas in Tanzania. They have so many underprivileged communities. They need help. How you can take a bigger role rather than you're doing voluntary. Maybe you can find the stakeholders who can be joined to support more and more and more. Particularly, you're doing an NHS, is that right? You have a lot of weight somehow to do something much better to advertise. Just tell me.
No, absolutely. Even if I'm, as a clinician, one day I'm hoping to also be in Tanzania to also work in the communities with the mothers and the babies. So not only can I run the programs and the projects, but as a clinician, I can actually do the practical work as well in the communities. But, for me to be part of the team, I can use my own experience to make certain decisions of how things could be better. And the main thing I will say is teaching and training. Once you have lack of education in the communities, to know how to make certain decisions and to know what to look out for, whether it's emergencies. So having that capacity building understanding of how to build a strong foundation around the workers. I'm sort of using my own experience and my sort of clinical skills, and also my sort of education of how I can sort of implement that in the communities. It sounds very complicated, but also, it's completely different because I'm not in the community. I'm in a hospital where my patients, they're already in the system. The mothers and the babies in the communities, they are not in the system. So how do I bring the families and the mothers into the system? So it's also to figure that out, not just how do I look after them, but how do I bring you into the system? How do I make sure we don't lose you as a follow-up? How do I make sure that my workers will come to you every single day? So again, I'm coming from a background where I have patients in the system already. They will come to me, whereas I'm looking to get these families into the healthcare system. in Tanzania. So it's very complex, but it's so interesting. It's so rewarding. I absolutely, it's very, it takes a lot of my time, but I love it because I'm learning more about Tanzania's healthcare system as well, and the policies and the procedures. And, even if things, look bad from the outside, but from the inside, Tanzania is a good country. They're doing their best, but also Tanzania has a 60 million people. So it's a very, very, very big country. So for you to look after every single individual is very tricky. So organizations like Tiba Salama makes a huge difference because we can cover certain regions in Tanzania to support that community.
Let me ask.
So yeah, it's amazing. I love it.
Yeah, well and good, well and good.
Sorry, that was a very long answer.
Yes, madam. I know you've been to one of the village of your father's side, correct? You've been to, you see Bibi, which is the grandmother, and did you find out anything that you feel inappropriate in terms of health sector in your father area in Kilimanjaro region, I believe, don't you? Is that Kilimanjaro region?
Yeah, I mean, we're based in Sanawari. My grandmother lived in Sanawari, but my family name is from Marango. So where
Marangu.
my grandfather is
Marangu
buried,
is a tribe.
yeah,
Is it one of the Chaga tribe?
Kilimanjaro. Yeah.
Yeah. Okay, good. Let me moving on is a different subject here. I hope is despite that you are on the clinicians, senior assistants, but also you are on a business as well in Tanzania, correct?
Correct.
Is any reason why before I move on, you decided, okay, let me doing something much more to help Tanzania, and you come up with a company which is called ALINES. Did I correct? ALINES?
Aline's Handmade.
Yes, handmade. Is there any reason why you decided to go into that particular brand and fashion, and why Tanzania?
So I started my brands maybe 5 years ago. So it's not new. And I started making all the clothes myself. So I was sewing myself at home. I was cutting the pattern. I did everything myself at home. Fashion shows, photo shoots, collaborations. But then after 4 years, I thought to myself, I can't do this anymore because it's a lot of work. I want to expand my brand. I want to get closer to Tanzania, and I want to sort of like understand the fashion industry in Tanzania. How do I do that? So I went to Tanzania for 10 days 2 years ago, and I met up with a very close family friend who is a very, very good seamstress who made this lovely top.
Yes,
So
that's
she
lovely
is
one.
my
That's
main
lovely one.
seamstress. Sante. So
Thank
she's
you.
my main seamstress. So I just spoke with her and said, I have this brand. I would love to work with you because I don't want to use any manufacturers. I want to use the local seamstress who are based in Sanawari, who can make the garments handmade. So she obviously was very happy about having that partnership. So she's the one who makes all the clothes now. So I'm sort of like investing in her business. So I'm paying her to make it. So not only can she also expand her business, but I'm also using all the fabrics from Arusha market. So I'm supporting the local businesses and the seamstress. And that also brings me closer to my roots. So I've had photo shoots in Tanzania. It's been amazing. So the past 2 years, I've reallocated my brand from London to Tanzania.
Okay, fine. If I look you, your dressing code is made in Tanzania, correct? Is Kanga, right? It's a very interesting
Yeah.
outfit for yourself and for some other people. Tell me about technicality of you using to design, how you supporting designing, because you say you've been doing this for 4 years and you said, oh, let me move into Tanzania and starting this business. Technicality for people who support you in Tanzania. Do you providing any training for them to do your work, or you normally they suggest something to you, or vice versa?
So it's teamwork, I would say. And when I used to do the clothes myself, I only used to do kids' clothes, not women's. So whereas now I'm only doing women's clothes. Before I only did kids' clothes. So it was hard for me to let go of sewing and trust my sort of creativity with someone else. But the seamstress I'm working with, Glory Minja, very good. She understands my vision. She understands everything I'm talking about. She brings her own suggestions. So we work as a team, as two female entrepreneurs making these garments. So once I come up with the idea, she'll like, Aline, yes, I know what you mean. And then she'll make a sample. And the sample she makes is absolutely amazing. I was like, oh my God, it's exactly what I'm talking about.
Okay.
So she understands my vision very well. She's a very, very good seamstress.
Okay.
Very
Is
good.
that is a tailor? Is a local tailor? Correct.
Yeah. So when you're female, you're a seamstress. Yes.
Oh, okay. Okay. And then basically, how many designing you have so far? And all of them is a Kanga materials or some other materials available in Tanzania?
I use different materials, but I like to use Kanga for each collection because Kanga is very unique. It's not very recognized in the Western world or other part of Africa. So Kanga fabric is very East African based. In fact, very, very Tanzanian and Kenyan. So using Kanga is a unique sort of selling point and also to make Kanga more recognized around the world. But I also use, satin, normal kitenge, cotton. So I use various, but I like to use Kanga because it's very unique. It has a very sort of special sort of statement.
How your mother proud of you being doing this kind of stuff? Is your mother as a Swedish? How she feel about you being a? Oh, I have a daughter here. Does a lot of traditional clothing handmade in Tanzania, and understood the root of her father. How's your mother feel about you being doing that as a daughter?
It's a very good question because when I say every time I launch, she has everything. She has all the blouses, she has all the jackets, she buys everything from me. She absolutely loves it. She supports it. She's wearing it. She's a teacher, so she'll wear my brand in school, and her colleagues will also buy it. She's
Okay.
always promoting my brand. She's a very, very proud mother. Without her, I wouldn't come this far in life. She's my true inspiration. She always supports me. She always backs for me. Whatever I create, she always buy it. Oh, Lena, I love this. Oh, I love this.
Okay. Okay.
So yeah, it's lovely.
It's lovely.
She's
All right.
amazing.
We are going to we're ending to finish our discussion. I have a couple of questions to ask you, and then we have a closing for our discussion here. Today is very lovely discussion with you, and very proud to be with you here. And then, as skills of yourself as Aline, you have the skills, don't you? As a pediatric, as a businesswoman into clothing, and so on. And for you and father to be a stakeholder locally, nationally, and international level, right? Because you're international level, correct? Is that right or wrong?
No, absolutely. I'm very international. Yes.
Well, I'm using local because you are doing in Tanzania as a local. National level, because you're doing in the United Kingdom, is a national level. International level means you're expanding more for your clothing and your designing and your brands. So, um, make you proud to enterprise business for handmade clothing. Are you planning to expand more into that industry to hire more people
Into fashion.
into fashion?
Absolutely. 100%. I think, I have a career, I have my children, I'm working for Tiba Salama, and I also have an Airbnb in Tanzania as well, but also my fashion brand. So I have to also sometimes prioritize what I need to do, but eventually I would love to expand my fashion brand. Absolutely. I want to work with more tailors. I want to work with more, models and photographers. I want to bring in the younger generation also to maybe, open up something that can sort of support the younger generation to become creative in media, in fashion or photography. So, but once I'm more established in Tanzania, it's easier. But being here in London, doing all the work in Tanzania can be challenging. So, one day, hopefully, I would love to expand. Absolutely.
Okay, and your expand will be in Tanzania, mostly
Yes.
Tanzania or other country in Africa. Let me touch into a little bit about what I call Tiba Salama as well. I'll move on to Tiba Salama here. Tiba Salama is not actually active right now in Tanzania, and I want you to make sure that Tiba Salama is being more active in Tanzania. And what you can do alongside with Mr. Simon, based in Tanzania, to make it Tiba Salama as an active entrepreneur company supporting underserved minority in Tanzania.
So, with any new innovations or startups, it takes a lot of work and a lot of time. So, we in meetings nearly every single day with Minister of Health and different partners across, America or Europe. So, I feel like for anyone who's creating a company or a startup or any innovation, it will take a very long time. So, we need a lot of patience and we need to work really, really hard to get to that level. But Simon is aware that I'm committed to get to that level with Sibat Salama. But as a startup, things do take time because it's funding, it's projects, it's programs and approvals. You can't just go into the community and just do your work. You have to work with the local governments. So it's also politics involved. But we're working very hard every single day to get to the point where we can launch the product and also our service that we want to sort of serve in the communities. But consistency and hard work.
Do you know also that any health sector can be either done by private sector as well as government, especially in UK? You have government very much involved in this particular area where you practice yourself all the time. But if you look Tanzania now, we need that kind of what we're calling it a database for health sector. And then I think Diju Salama, Tiba Salama is a good example right now. Its only thing is to push back to the government to be much involved and allow this kind of company to take place in Tanzania. How do you think about I know maybe you don't know this answer. Maybe you can have some idea about this, about data system that taking place in UK and the data system take place in Tanzania for medical professionals.
I mean, mainly most hospitals in the UK have a patient electronic system. So we don't use much paper anymore. Everything is done electronically, and that's what Tanzania are also trying to move into. We're trying to reduce the paper and start using, apps and like a digital platform. I haven't spent much time in hospitals in Tanzania, so I don't know how much paper or computer science they're using. But like you said, Hiba Salam are trying to introduce the innovation to become more digital and less paper based because using paper is very easy to lose the paper with all the information. Whereas if you have a very solid data system, you make sure that you keep the patient information secure and also you can link it with other hospitals. So in the UK, you have a clinic appointments in your community, but that appointment is sort of registered online, which also connects with the local hospital. So Tanzania are sort of looking to get into that sort of sector as well. But again, things takes time, and the government, they have their own ideas, they have their own innovation. So not everyone can come up with certain things before the approval, but what we have created is so good. So we just keep on pushing, working with the government and just trying to show them that this is great. Just but yeah, it's a work in progress.
Okay, Let me move on to a very specific question here. In a significance of the world economic change now across in many nations, including UK, what is your advice and experience to bring into Tanzania, particularly in medical area? And I understand, as you said earlier, you are planning to relocate in Tanzania for the future life, for your place or for your father. So what kind of advice? We're coming to the end of our discussion here. Just give me these brief questions. What is your advice to Tanzania?
So you mean advice for anyone to when they go to visit Tanzania, sort of like ideas of what they can do, or ideas of what they can create, or what do you mean in terms of what they can do?
In medical field, number one,
Okay.
that's is very important things into daily life. Even you are in England now. One of the priority, if you get sick, you can go to hospitals, right? And you have technology, you have doctors, you have so many things that combined make you feel proud living in UK because that necessities are available. So that means into these questions means what is your advice? We have an inadequate system in Tanzania and some other areas. As a you, what is your advice? As a person that you've seen in England and what you can do in Tanzania for the better future.
Okay. Well, I guess just being part of Tiba Salama makes a difference because we want to bridge the gap between the communities and the hospitals. So also we had to remember the layout in the UK and Tanzania is very different, very different. So again, Tanzania is 10 times bigger than the UK. So for families who live so far out in the communities, for them to get to a hospital is sometimes impossible because of the landscape. The UK is sort of like built a bit different, and also the roads, in Tanga region, how you're going to get to the hospital with these roads. So there's lots of things that you can think of if you want to improve any access to healthcare. Roads, that's the number one thing. Transportation from house to the hospital, like an ambulance. So not only is it just the actual hospital, the healthcare setting, but also how do you get to the hospital? It's a thing as well, isn't it? How do I get to the hospital? So Tanzania is obviously a different landscape, so the roads are different, the system is different. But I would say anyone who wants to sort of join the healthcare system in Tanzania, just bring your skills and your innovations, but come as a guest and not this is what I want to do. You come and you share your ideas and you work as a team, because Tanzanians also know what they are lacking in a way of the healthcare system or the roles. They will also teach you. So I'm not coming in just to teach them. They're also teaching me a lot of things. And that's when teamwork comes together. We bring our skills together to make the solution better.
Okay, that's fine. That's fine. Final question to you, and hopefully, you are the owner of the ALINES Handmaids clothing. I believe it is a milestone for you to achieve and accomplish. Where is your product available? Where are you selling your product, and how you create customers through your product?
So my products are mainly based online. So I don't have a shop anywhere, but I did think of opening a small shop in Arusha to sell some of my clothes. But everything is done online, which makes it easier internationally. So my Swedish customers, my UK customers, or if you're based in America, so everything is based online.
Okay, everything is based online. Finally, questions to you today. I hope you be able to give me some insight about these questions. And very technical one. It's not a really technical one. It is very simple to answer. How do you feel about Tanzanian people culturally, and how do you define yourself as a part of Tanzanian society, including your father roots uh, as a Chaga region in Tanzania? Can you give me the ending of our discussion on these questions, and then how you feel about Tanzanian culture in general.
So Tanzanian people are very, very chilled and laying back, and I love that because I'm the opposite. You know, in Europe we stress a lot. We're always rushing. You have to be on time, or while you're in my way. You know, Tanzanians they just everything is pole pole. You see, they take their time. You know, they have their naps.
Yes,
You know,
means
so
poly.
I like
Yeah.
that. Yeah, I like that they're very relaxed, you
Mm.
know, but I respect the culture a lot. So, like I said, as a teenager, when I saw how my cousins were talking to their parents and also how much they helped at home, I can really reflect how the Western world households are so different from the Tanzanian culture. The level of respect, you have to listen, you have to do you know, whereas in Europe, it's the complete opposite. So I think I also personally developed by seeing the beauty of the culture, how you respect your elders, how you should speak to your elders. I think that's very, very important, even in today's society, for our children to have that African culture background is everything. But Tanzanian people, you know, they are my people. I'm a proud Chaga. I love my country as well as I love my Swedish side as well. But yeah,
Yeah.
it's great.
And how you feel proud to be a Chaga in Tanzania?
Very proud.
You loved it.
Of
Have you
course.
experienced anything learning about Chaga tribes in Tanzania? Just ending our
Yeah, I
discussion
mean, my
here.
family always talks about it, and you know, they eat chaga food, and you know, yeah, but we talk about it, and we all entrepreneurs, we all working hard. We're very like united family. We have meetings every year in Marango. So the whole Minja clan, there's so many of us are meeting in Marango once a year to unite as a family. So I think as a Chaga tribe, that's very important. That's something we always done for generations. Every year we meet, we have like meetings and we eat and just gather because we all live in different places in the world and also in Tanzania. So coming together every year in Marango with the whole Minja clan is lovely.
Oh, yeah, absolutely. I believe because Chaga people in Tanzania, they are very aggressive also in business. And that's the reason why you copy it yourself, become a business owner of the handmade clothing in Tanzania because they are very popular, aggressive, very economic, very dynamic in Tanzania. Well, it is always a pleasure. Is there anything maybe you can tell the audience here how yourself to the ending of our discussion as Aline Minja with the roots of the father from Tanzania and Swedish mother? Can you tell the audience how you feel yourself being a diaspora of Tanzanian origin as well?
Yeah, I'm very proud. And I feel like, my brothers also call me the African auntie because they feel like I'm more towards the African side than the Swedish side. But to me, I feel like I'm a blend of both. I love Sweden as much as I love Tanzania, but I feel like I resonate and connect more with Tanzania. Probably because I grew up in Sweden, so I know what to expect. I know what the sort of the layout is looking like. But I'm very proud of both sides. My parents are amazing. My mother is obviously incredible. My father did a good job by taking us back to Tanzania frequently. And my mother is a mother who understands and never restricted us to learn the Tanzanian culture. She would say, "Go, go, yes, very good, go." So she never restricted us for us to learn about the other side of our culture. She's been very supportive. And she met my father in Tanzania, so she knows my family. They always ask about her. So she's been in Tanzania herself many times. So she's also well aware of Sanawari.
It's a great pleasure to be with you today. It's a great
Asante.
pleasure and very excited to be having you here in my studio directly from Seattle, Washington, and you are currently in the United Kingdom. Thank you very much for Madame for joining with me here. It is lovely, lovely to have you, and I look forward for the better future in terms of what you're doing in terms of healthcare, working alongside with Tiba Salama and your business ownership of Handmade in Tanzania. Thank you very much. Look forward to continue next episode together, talks about different issues related to Tanzania as well in Africa and globally. Thank you. very much. Is there any other insight you want to end up today with me here?
No, thank you. Thank you for having me. It's a pleasure. It's my first interview podcast. I've done well.
Yes, you done very well.
But
Don't
yeah,
worry
thank you
about
for
it.
the opportunity.
Yeah.
I appreciate it. Thank you so much for your
Thank
time.
you very much, and yourself too. Take care in London. Best of luck for your business and your future. It's my pleasure to
Thank
have you.
you.
Thank you.
Asante.
Asante
Thank
sana.
you.
Thank you very much.